Hello, Professor and fellow classmates. My name is Jerry Schramm, and I'm going to do my online presentation on the course outcomes currently reached in our course. This is a brief course description. When looking at the course description and the course outcomes, this is what's posted. At the completion of the course, this is what we're meant to achieve. So I looked at the 5 outcomes that are expected upon completion of the course. This is a list of the outcomes. When I considered on how to deliver my material, I considered first going through each of the 5 outcomes. However, having not completed all 5 yet, not completed week 5, I thought maybe it was best to come with a different approach. And each obviously takes week to week and all the information that was gained through the course to be able to effectively understand an HCO, understand strategy, develop strategy, and remain competitive. So what I did was I took each week's outcomes and broke it down and answered some of the outcomes just on the information that was gained. So week 1 in the outcomes was defend the importance of a board of director in providing oversight to performance monitoring and strategic development processes in healthcare organizations. I guess the biggest impact of a board of directors is their fiduciary responsibility. They're meant to be involved, make sure that the organization functions appropriately, create a checks and balances on the CEO and the leadership team, and if the board of directors is properly balanced, they have a lot of resources to be able to offer, and generally some insight that perhaps isn't being considered. Decide who gets involved, their roles, and the advantages. So strategic planning is the process an HCO uses to determine its future directions and the actions that will shape it. That's according to the text from Harrison. A CEO should absolutely be involved. It's the executive director and the chief decision maker, the CFO. Any initiatives that are going to be set, the direction of the organization, its current position. This is all going to be dependent on the revenue, expenses, financial balance sheet, and any cost of the initiatives. Obviously, the CFO would have that information. The chief nursing officer and the chief medical officer have the clinical perspective to be able to offer this as a clinical service delivery with a health system. So obviously their impact is integral, and the board of directors, again, with the fiduciary oversight and acting as a resource. Possibly others depending on the initiative and the strategy. If we're rolling out a new initiative, obviously you may want to include the chief marketing officer for how to deliver that material. But there's always risks. The more people involved, the more ideas, perspectives, and it very well could wind up being paralysis through analysis. Explain mission, vision, and values. I thought the Baptist text case study that we had done really did the best on talking about mission, vision, and values. The mission, why do we exist? Vision, what are we striving to become? And the values, what guides our everyday behavior. I thought this was really awesome, and things that I really valued and I took with. I really like those definitions. But having purpose and direction for the HCO ensures the strategy aligns with the global direction. So by incorporating those 3 definitions, the decision making and the strategy should all align. Number 4 is consider how the HCO monitors performance, develops relationships, executes strategic plan. There's a variety of commercial software out there, dashboards, different surveys, statistics, CQI, all absolutely fantastic ways of being able to monitor progress from clinical patient satisfaction. And then a periodic SWOT analysis is optimal as well. Relationships, transformational leadership, engaging internal and external staff, ways of building and establishing relationships, cultivating relationships, and to execute a strategic plan, you need buy-in from the workforce and everyone involved in the organization. Evaluate the impact of transformational leaders. Defined in Harrison as a model of leadership that emphasizes flexibility, selflessness, interpersonal motivation to maximize individual and group potential. But basically, there's a lot of transactional leadership in healthcare. The clinical decision making, it needs to be done a certain way and consistent. You can't have people freelancing when it comes to patient care. But transformational leadership, developing a culture, improving morale, inspiring employees, motivating and challenging staff. That's all extremely important. Just going through and treating a chest pain is fantastic, but the patient care and customer service go above and beyond. And when a leader is able to engage staff, inspire them, that customer service going and doing above and beyond in those little extras, they're going to become part of the ingrained culture, and that's all based on the leader. In week 2, focused on competitive analysis, learning, focused on the strengths and weaknesses of an HCO, developing strategy, and being competitive in the marketplace. So assess how a strategic group map is used to show competitive positions, various HCOs, SWOT matrix, force field analysis, gap analysis, basically anything that can become visual to look at where your organization is, where the competition is, and where you need to go. Evaluate HCO's competitive strength relative to key rivals. Porter's competitive analysis did a great job with that, being able to look at differentiation and cost leadership, where others are in the market, and where strategy should be focused to making sure that your HCO stays competitive. Discriminate between an HCO's strengths, weaknesses, opportunities, and threats. Pretty straightforward. Conduct a SWOT analysis. Articulate the importance of financial planning in an HCO strategy. Financial planning, some of the same reasons that the CFO is involved in crafting strategy. You need to look at the revenue expenses, the return on investment. You may need to discontinue a service line if it's not profitable. Having the CFO involved and looking at the financial planning will continue to make sure that the organization is successful. And compile the challenges in implementing a strategic plan. Workforce buy-in is the biggest one. Again, we're customer service based. We're providing clinical care. Without the workforce buying in, it will not be successful. The financial impact, the board of directors support, effective marketing plan, and oversight and motivation are all key. In week 3, you continue to focus on strategy. Included the HIT. Technology is a big part of it. Diversification, partnerships, joint ventures, mergers, they were all discussed. Consider the role information plays. Well, everything is digital now. Most patient care reports are conducted digitally. Nurses are carrying tablets. I know Emergency Medical Services conducts everything via tablets, cell phones. It's just technology is everywhere. So statistics and trending, it's all able to be done through the use of information technology. Integrated healthcare and patient care plans require portable patient record systems. If you're going to be moving into the direction of the HCO, having managed patient care plans, this information needs to be accessible at all areas. It needs to be portable. Patient access, they need to be able to see their health records, do research. More and more people are going onto portals online, doing research. They want to be informed consumers. Telehealth is certainly making its mark in the health industry. HIPAA and information security, all very important with information technology. Summarize the various ways an HCO can be diversified and reasons why. Partnerships with physicians integrating into an HCO. Increased service lines such as end-of-life care, skilled nursing, rehab, outpatient. The author, Stuart Butler, really had a great article where hospitals really should transition from being a one-stop shop of providing everything to more or less being a hub, diversifying, having a lot more outpatient, understanding that the traditional approach very well may not be the direction of the future. Contrast the difference between diversifying and related and unrelated businesses, pros and cons. Related allows for coordinated care, taking advantage of capitated payments, negative reimbursement, regulation changes. Everything's constantly changing, so having everything focused in one direction may be a negative. And unrelated allows for flexibility. It may not align with the mission, though. Loses focus and revenue in meeting the mission if it's not focused on what you're looking to achieve. And evaluate how HCOs use alliances, partnerships, growth in size and services, economies of scale, improved reimbursements through integration of services, Medicare prospective pay system, all fantastic opportunities through growth and diversification of services. Explain the changing demographics. The baby boomers are nearing retirement. They're very tech savvy and informed. These are educated individuals who understand quality. They expect quality, so the service has to be excellent. They'll need integrated healthcare, high quality and accessible, offered in non-traditional ways. You're seeing this more and more in long-term care, continued care retirement communities where you're able to age in place. But as staffing needs grow with this large population of retirees, their shortages are going to require out-of-the-box thinking. The traditional approach may not be plausible. In week 4, we discussed the importance of leadership and workplace culture and how it impacts strategic plans. Some of the ways in HCO leadership or culture may affect implementation of strategic plan. In Harrison, he discussed how a positive work environment directly impacts the care that's provided to the patient. You have to empower and support the workers, show them that they're valued. And workers are the most critical component in a clinical service industry. Their actions implement a strategic plan. It's great to want to roll out a new initiative, but if the workforce doesn't buy into it, if the workforce doesn't support it, it's not going to be plausible. Evaluate the value of positive change management. Baptist Healthcare was a great example. They knew a change was needed. They couldn't be competitive just on financial or offering of specific services. There was a lot of competition, so they went all in changing their culture and vision. They went for service excellence. The leadership led from the front. They led by example. They inspired and empowered the staff, and they remained flexible because their environment continued to change. They added new features, revised their pillars. They just continued to remain flexible. And organizations that remain traditional and inflexible, they're not going to last. Justify the importance of ethical considerations. The ethics of the leader is going to be observed by staff. It can lead to fines, lawsuits, sanctions, lost reputation, bankruptcy, all poor things by making unethical decisions. And consider a service line. If offering maternity and you're the only one offering maternity in the area, discontinuing that service without another option is certainly an unethical decision. Week 5 outcomes we haven't reached. We're just touching on week 5 yet, so we haven't gone through all of those outcomes. But it does talk about the future of healthcare, reimbursement, government regulations, and it really brings everything together to accomplish those 5 outcomes that were cited in the course. Conclusion, this course will provide insight to analyzing HCO's competitive position, crafting strategy to remain competitive, and staying observant to those forces impacting an HCO. This is a list of the references I utilized. There's still one more week to learn. I think I've gained a lot of knowledge throughout this course, and I hope everyone else has too.